This presentation is on child abuse and children with disabilities, presented by Primrose Johnson. Disability is defined in the Americans with Disabilities Act of 1990 as a physical or mental impairment that substantially limits one or more of the major life activities. The findings of the 2001 U.S. Census Supplementary Survey indicates that 4,185,627 children between the ages of 5 and 20 in the United States have disabilities. Most of the studies concerning abuse or neglect of children with disabilities have produced findings indicating that children with disabilities are more likely to experience abuse or neglect than persons in the general population would. High proportions of children with disabilities in state custody as a result of having been abused and neglected suggest that there is a relationship between disability and abuse or neglect. Introduction continues. Recent research has focused on the memory and communicative capabilities of children with disabilities, but little is known about the characteristics of those believed to have been abused. Children with mental, including communicative and learning disabilities, are 2 to 3 times more likely to be victims of child abuse than typically developing children. Children with disabilities are a vulnerable population in many ways. These children have generally been subject to abuse and neglect, but may be victimized in a host of other ways as well. These disabilities may limit the children's ability to provide relevant information about abuse to investigative agencies and police. Problems being addressed. Children with disabilities are underrepresented and thus their abuse and neglect goes unreported. Due to their inabilities to communicate effectively, children with disabilities keep abuse to themselves. Under-recognition in the child welfare system is another problem. Studies have shown that caseworkers often identify children with disabilities in their case notes as having mild developmental delays. This causes the estimate of disabilities in the population to be greatly smaller than it really is. Most child welfare workers have the best interests of children at heart and work diligently on their behalf, but may never have received training in identifying and responding to disabilities. Because states are not required to submit data on the disability status of abused or neglected children, there are discrepancies in the numbers which makes it difficult to accurately estimate the rate of maltreatment among children with disabilities. Families are sometimes left with the burden of caring for their loved ones alone because service providers do not have the adequate training to take on children with disabilities. Another common problem is finding service providers who are trained to work with children with disabilities. Why should society be concerned? Society places a high value on having a beautiful body, whereas having an unattractive features is a sign of inferiority. Unfortunately, this concept has caused people with disabilities to be the object of cruel jokes, and this occasionally led them to be shunned or treated unfairly. Society's negative attitudes toward this population is driving them further into isolation and pitted with sympathy. Society does not interact with children who have disabilities because they are uncomfortable around them. Society needs to have a vested interest in creating a society that respects children with disabilities. The negative attitude society shows children with disabilities have been a factor in preventing them from reaching their full potential. Society should also be concerned at how they have further beaten down a population that need their help to protect and lift them up. Synopsis of the program. This investigation was done over a period of 7 years, from 1997 to 2004. Typically developing children were compared with children with disabilities, determining whether children with disabilities have the same understanding of abuse or whether they were more prone to abuse than their developing peers. In order to determine whether the degree of disability was associated with the suspected abuse of children with disability, children with severe disabilities, minor disabilities, and typically developing children were compared. These questions were asked: to what extent do children with disabilities disclose abuse or delay doing so? Are alleged abuse victims with disabilities more or less likely than victims without disabilities to be victims of sexual as opposed to physical abuse, and does this vary depending on age or gender? Does the level of disability affect children's understanding of the crimes of, of which they may have been victims? Assessment of the program. The investigators provide an assessment of the degree of disability, the children's characteristics, details of the offenses, the identity of the perpetrators, and their relationships to the victims. According to this report, children with disabilities fail to understand the suspect's motive and the nature and extent of abuse. After putting these data together, the authors concluded that in order to stop or minimize the abuse of children with disabilities, this population needs to be educated. They also need to be informed about the risk involved and the implications of not reporting these abuse. Since abuse almost always starts within the families, they need to be trained on how to deal with a child who has disabilities and how to detect signs of abuse. Basically, the authors wanted to find out how the abuse started, how frequently, how and when the suspect abuse came to light, and whether there were any injuries reported in the medical report. Assessment of the program continues. Child welfare services need to provide specialized assistance for children with disabilities. Studies show that this population of children are not adequately protected, even though many professionals are likely involved in their care. Because children with disabilities are less likely to report abuse, they need to be encouraged to talk about this issue. The community needs to play a part in acceptance of this population so they can feel more welcoming and not being treated like outcasts. If everyone starting with a family plays a part and start by first accepting children with disabilities as a person, this method will show some improvement. Educating people about children with disabilities will greatly improve the way they are being treated. In the text, Treatment of Physical Abusive Families, It states that abuse usually ceases as soon as the social service system intervenes. Assessment of the program continues. It also states that the future protection depends on the parents learning to cope differently. If parents can recognize the feelings or events that led to the first abuse and learning alternative coping skills to handle anger and frustration, learn to understand child development so they can adopt realistic expectations of their children, they may also gain more pride in themselves. Considering the increased risk faced by children with disabilities, efforts to prevent abuse should be coordinated and multifaceted. Prevention should also be aimed at the general public or targeted specifically to families at risk of child abuse. There is an urgent need to develop and implement strategies that may help children with developmental disabilities disclose abusive experiences more swiftly and effectively. Where program is being tested. This program looks at prevention at the society or community level, followed by family-focused and child-focused prevention efforts and prevention of non-familial abuse. This program supports community-based efforts to develop, operate, expand, enhance, and coordinate initiatives, programs, and activities to prevent child abuse and neglect, and to support the coordination of resources and activities to better strengthen and support families to reduce the likelihood of child abuse and neglect. It fosters understanding, appreciation, and knowledge of diverse populations in order to effectively prevent and treat child abuse and neglect. Abuse and neglect prevention activities and family support programs are made available throughout the community in support of families and agencies. This program has an emphasis on the involvement of all parents in the planning and program implementation. Where program is being tested continues. Efforts are being made to support programs such as voluntary home visiting programs, parenting programs, family resource centers, respite parent mutual support, and other family support programs. It has an emphasis on promoting the increased use and high quality implementation of evidence-based and evidence-informed programs and practices. Like every treatment/program, especially new ones, there are no guarantees that one approach will work. An assessment program which focuses on the continuum of evaluation approaches which use both qualitative and quantitative methods to assess the effectiveness of the program and activities has been put in place to see how well this program will work. Conclusion: learning more about how to improve chances for success for children can positively affect the everyday experiences and futures of many, many children and families. Increased awareness of and attention to the problems and needs of children with disabilities can begin to provide that information and will benefit both child welfare professionals and families they serve. Social workers have to recognize and challenge their own apprehensions of impairment in order to become effective change agents in combating prejudice against those with disabilities. Caseworkers, program managers, administrators, and policymakers all need information for planning and delivery of programs and services. Coordinated efforts should be made to protect from victimization vulnerable individuals who already have difficulty coping with everyday life. Conclusion continues. Children with disabilities are more at risk of abuse and neglect than children without disabilities. The factors that place these children at higher risk of abuse include factors that place all children at risk in addition to other risk factors that are more directly related to disabilities. There are a number of promising strategies to prevent the maltreatment of children with disabilities. They can be implemented at the societal level or focus on addressing family strengths and needs as well as educating children about abuse and ways to prevent it.